For those of you who don't know, my name is Marta Freiler. I am a nurse recruiter with Virginia Hospital Center, so just over the bridge right there in Arlington, not too far away from you all. I have been in nurse recruitment now for 3 years. I've been with the hospital for 8 years. Prior to my recruiter position, I was a mother baby nurse in the hospital as well. So again, excited to be here and present to you all tonight.
Thanks so much. And I'm Annie Parker. I am also a Georgetown grad, Hoya Saxa, though I won't tell you how long I've been out of school because it's embarrassing. But I have worked at Georgetown for over 10 years and in recruitment for over 10 years. I started as a peri-op nurse, a PACU nurse here at Medstar Georgetown. I'm very happy to be with you tonight and looking forward to chatting with you more about our interview tips straight from a recruiter's mouth. So feel free to ask us any questions that you have throughout the presentation. It's really meant to be helpful for you. So we don't mind if you stop us during the presentation to ask us anything that's burning. You can also put in questions in the chat and Marta and I will keep an eye on it and make sure to try to field those questions. And I'll pass it over to Marta.
So we'll go ahead and start off by talking about everybody's favorite part of an interview. And that is the part of just being nervous overall. This is where we will tell you to kind of shake that off a little bit because, and we'll tell you why. This interview, it might seem like it's one way where they are interviewing you, but really it's not. It is you also interviewing them to see how it's fitting for both of you. So when you're set up with an interview and whatnot, they are very interested in you, but also you are taking the time out to get to know the organization. You're taking the time to get to know the units that you are interviewing for. So just keep that in mind. It is just as much an interview for you as it is for them. One of the other things that we do like to note during the interviews, this is a time to talk yourself up. This is a time to talk about you. Let yourself shine in a way that your resume doesn't allow you to. Talk about the things that maybe you couldn't put on that one page that you're limited to. This is an opportunity to give them every reason why you should be hired on that unit and in the organization. So just some of those things, excuse me, to keep in mind. Another thing that we like to mention with regard to interviewing is making sure to take your time and also preparing. So this is kind of like a two-step way. So taking your time, well, we'll start with the preparing. So before your interview, and we'll go into more detail about this throughout the presentation, but taking the time to be prepared before the actual interview, having those questions, being appropriately dressed, having all the materials that you need, taking care of all of your environment, AKA kicking your family out of the house if you need to, or finding yourself a space that's quiet and where you can focus on the interview itself. No distractions whatsoever. The other part to that is also during the interview in itself, it's okay to take your time to think about your answers, think about the questions, and then being able to fully give them an answer that you want to give them. And so, like I mentioned, we will go into more detail about, being prepared about what questions you want to ask and how to prepare. But from there, I am going to hand it back over to Annie.
Thanks so much. One of my favorite ways to take your time is to bring a prop with you, which is a bottle of water. And if somebody asks you a question that you're not prepared for, it's a great time to take a sip of your water and say, give me a moment, I'll think about that. It just buys you a little bit of time for your sort of brain to catch up with your mouth and your words. So always feel comfortable, taking a moment and pausing before you answer a question. And so the information on this slide is pretty self-evident, but I'm just going to go over it with you because we've seen a lot of different things. So we just want to make sure that you're not making some of the same mistakes that we have seen candidates make in the past. First impressions really count. So before you go into an interview, I think it's always helpful to look in a mirror and just make sure that you look the part. You always want to arrive early. And this is especially true when you're interviewing for a hospital-based position, because you would be shocked at how long parking and transportation can take from the hospital. So I would always make sure to budget a lot of time to get yourself to the actual interview location. If you're interviewing in person, you can bring a book, you can grab a coffee before you will go in, but it's always better to be early, because nothing will make you more flustered and less confident than arriving late for the actual interview. Of course, a confident handshake comes from before the time of COVID. Now it's more like a confident handshake or elbow bump. We always ask candidates which they prefer for meeting them in person. In terms of virtual versus in-person interviews, we're going to talk a bit about both of these options. I recommend personally that if you can interview in person, great thing to do, but more for you than for the actual employer. It really helps you to be sure when you're making the decision if you've stepped onto the unit, if you've met the manager and educator in person, if you've seen how the nurses interact with the patients and what the environment looks like. I think it really helps you to make sure that you can picture yourself there and that the environment is a good fit. But one of the things that you could consider would be to virtually interview in person, or virtually interview first and then request a shadow day or an in-person share experience if it feels like a good fit. But regardless of whether you interview virtually or in person, as Marta said, really important to be prepared, have that list of questions, have the copies of your resume, or if you're virtually interviewing, have it easily accessible so that you can upload it into the chat. And then that bottle of water. Gum is such a funny one, and I only add this because the managers ask us to every time. They continue to interview with candidates that are chewing gum, and they really hate it. So just as a reminder to you that that's something that you shouldn't be doing while you're interviewing. And I know all of you know that, but in terms of attire, again, this is pretty self-evident, but really to dress professionally, and not just professionally, but comfortably as well, especially if you're interviewing in person. And that's because you don't want it to be a distraction. You know, if your dress is too short and you're pulling it down all the time, or if your shoes are really uncomfortable, it's going to be something that throws you off your game. The shoes I point out in particular, because you have to remember that the person that you're interviewing is probably going to be wearing scrubs and running shoes. So you want to be able to keep up with them when you're walking around on the unit if you're interviewing in person. So just be comfortable so that you can be confident. Also, be conservative, because if you have body jewelry or tattoos that are visible, you know, those might be something that you would want to cover up, because hospitals have different levels of sort of dress and attire policies, and you just might want to err more on the side of being conservative during an interview. I'm about a virtual interview as compared to an in-person interview. And what we're seeing now is that most organizations are offering you the option to select if you prefer. If you do interview virtually, oh, and someone just asked about a suit. I do recommend a suit or something similar in terms of the level of like professionalism. So a suit or pants and a skirt and a blazer or khakis, something like that. And again, more to make yourself feel confident, but it just really helps you to look the part. Blazers are great too. So back to the virtual interviewing. So I think something that's really important to remember, and that we often see candidates failing to do, is to take the platform of the interview for a test run. So for instance, this is a Zoom, as you can see. I'm much more accustomed to using Teams, Microsoft Teams, and all of our interviews at Georgetown will be on Microsoft Teams, but it might not be something that you're very comfortable with. But it is a platform where it benefits you to download the app and actually sort of get used to it before you start the interview, so that you don't have any audio or visual technical issues. I primarily see candidates interviewing on Zoom, Teams, or WebEx. And so those would be the three to familiarize yourself with if you're considering a virtual interview. And again, just as soon as you get that link, try it out, make sure that you know how to use the platform so that it's not something that hits your confidence during the interview session. This may sound silly, but Marta and I were both saying that we actually recommend that when you are participating in a virtual interview, you should actually dress fully from head to toe, not just what the recruiter will see or the manager will see in the screen. Again, what you're trying to do is put yourself in the complete mindset that you are interviewing for a position and that this is a professional meeting. So it really helps you to sort of get yourself there, to sort of be prepared, appropriately nervous, and professional for the actual meeting. We always want you to look at your background. Again, all of this is self-evident to you, but the recruiters and the managers that you are meeting with do look at that stuff. And if your bed in the background isn't made or something like that during an interview, it may be something that is a distraction for them. Just in general, you want to make sure that your environment is free of distractions. So as an example, I can't tell you the number of dogs and cats I've seen during interviews, and some managers love that and specifically request seeing your pet, whereas others feel like it's not the most professional thing. So just to be sure that you are free of those distractions and that you have your computer or device on a stable platform so that you're not bouncing up and down, which can be distracting for some leaders. Always good to arrive ahead of time. 10 minutes early is beneficial. And then we recommend that you ask managers and educators and recruiters to send you their contact information in the chat so that you have all of the information that you need in case you have follow-up questions for them. So those are some of the things we've learned after almost 2 years of virtual interviewing. And then I'm going to pass it back to Marta.
Sure. Before I move on, I was going to ask you, Annie, if you wanted to share that story about the nurse that you mentioned to me, where she was in a different interview setting, and basically letting them know it's okay.
Yeah, thank you for reminding me. That's a good one. So in the interest of minimizing distractions, I wanted to share a story about a really excellent nurse who I had an interview with. And so she picked up she started the interview, and it was pretty clear that she was in her car. And so at first I was a little taken aback. And then she said, I have a young child in the house, and this is the only place that I could interview and really give you my full attention and not be interrupted. And so she took something that could have otherwise been, something that would have reflected not poorly on her, but would have been something that was noted by the manager and recruiter, and really made it a strength that she was focused on, being professional and giving the interview her full attention. So that is to say, just as long as you sort of address the elephant in the room, it's perfectly fine if you're taking the interview from an unusual place like a concert.
Thanks, Annie. Yeah, and I have certainly also had my share of candidates let me know ahead of time, like, oh, I'm going to be at work, or I'm going to be doing this or that. Is it okay if I'm going to be in my car? And I have told them that's fine. I will make sure to let the managers know, give them a heads up so that they are also not taken aback. But then I also encourage them to, remind them about the situation. A lot of people we found are a lot more understanding, especially if you explain. So moving on to preparing for your interview. So I touched on this in the beginning, in the introduction and whatnot, but there's a reason why you are applying to the hospital or hospitals that you are applying to. So a lot of the time when the recruiters are reaching out, we're asking, why do you want to come work here? And we can tell when you've done your research, which is great. It tells us, you're really invested in learning more about the company, the organization, learning more about our culture and whatnot. So making sure to do your research, and, even sharing maybe some personal anecdotes that you have is a really popular comment that I see or hear, is that, I've had, I was a patient here, or a family member was, and so, et cetera, like that all really speaks to your candidacy with an organization. Other questions to ask, and these may be answered along the way in terms of your interview, but definitely things to be prepared to, kind of like check your list off. Like, did I learn about the orientation, what that's going to look like? And ask about the hospital orientation, as well as the unit orientation, because those are two very different things that could be confusing. So making sure to ask orientation questions to the recruiters and then the unit managers themselves. asking about your benefits and salary. So these are things usually are presented or uh, provided to you on the front end, like for example, benefits or salary. So we like to make sure we provide that information to our candidates so they know upfront, and it's not an awkward time where you ask your manager, what's the pay salary or what's the salary for this position? So you can always defer it back to us. And then again, like Annie mentioned, asking about shadow days or getting the opportunity to get to see the actual organization or the unit. If your initial interviews were virtual, getting that opportunity to see the place where you could potentially be working. Again, with the teamwork and the culture of the institution, something that you would get on a shadow day or just visiting the organization. I'm not sure how exactly Georgetown does it, Amy, but for at least at Virginia Hospital Center, we do have a part in the interview process after the hiring manager interview is you are invited, if selected, to move forward to complete a peer interview. So this is a really great opportunity for the candidates and the team members to really meet and talk to one another to see how you would be a good fit for the unit and the organization. And again, it's also a really great opportunity for you to be asking them questions about what it's like to work on that unit, what it's like to work for the organization, and then some. And then ask about the challenges that they might face as a new grad on that unit, or maybe even in the organization. Getting those different perspectives from everybody that you talk to, I think that will kind of really help shape your decision in choosing the best fit for yourself. Retention is another huge one. And I will be honest that I got this question from a new grad, prospective new grad, in one of my screens, and I was a little surprised. I don't get it very often. During this conversation, it wasn't something that I had actually mentioned. And I thought it was a really great way to emphasize, how our residency programs, and I'll touch on that in just a little bit, how our residency programs have really impacted the retention rates, specifically among new grads after that 1 year. So really great question to ask, not only the recruiter, but even also the unit managers. And then other things, just to finish off the list, are any kind of special projects, special initiatives. One of the other questions that I get a lot too are like growth, are how can I grow in my position? How can I grow in the organization? And I love talking about that because I've personally been able to experience that. And I think that getting that perspective really allows the candidate to put themselves in the shoes of somebody who would actually be very successful in an organization and unit like that. I think I went through that. I did want to touch on, asking about the the residency programs themselves. A lot of the organizations around the area, I think there's only one or two maybe that don't use this program, but we do follow the Vizient program for our residency program. So asking those organizations what they follow, what they use to run their residencies.
Thanks so much. And we as well use the Vizient AACN Nurse Residency Program, which is the year-long program. And if I could give you one piece of advice about selecting a new grad position, it would be to choose an organization that does offer a residency program, because it really invests in your success. So hopefully you'll be able to find a position in a residency program. So we're next going to talk a bit about behavioral interviewing. So basically, I think the long and short of it is, if you get to the interview, that means that you most likely have the minimum qualifications for the position. And at that point, as Marta said, it's really about fit and finding someone who's going to be a good match for the opportunity and whose goals align with the goals of the organization and the unit. And so one of the best ways that the managers can get a really authentic perspective on you is to ask you behavioral interviewing questions. And the theory behind it is that the behavioral interviewing question says the past performance is the greatest indicator of your future behaviors. And so they're essentially like anecdotal or situational questions where we ask you to reflect on a time when you were in a particular situation. So many of you may know about behavioral interviewing questions, and you can certainly Google to prep a little bit more on sort of how to best make yourself ready to answer questions like this. I think the best way to do it though is to really spend some time reflecting before you go into any interviews. And I would ask yourself questions about like, what is the most meaningful patient that you've worked with in your time in nursing school? What was the best day that you had in clinical? What was the worst day that you had in clinical? Like, what's the biggest mistake that you can remember making either in your professional life or personal life? And, you know, a great example of teamwork when you were in a team that was very successful. So sort of reflecting on experiences like that put you in the mindset to be able to like explain the situation well to someone else. And so one strategy that you can think about using is something called STAR, which you can Google and find out a bit more about. STAR stands for situation, task, action, result. Situation, of course, is providing the context. Task is sort of your responsibility and where you played a part in it. Action is the steps that you took to resolve the issue, and result is the actual resolution of the issue. Another very similar one is called CAR, which is context or challenge, action, and result. But it's the same idea, sort of creating the environment for the person that you're sort of answering the question for, and then talking about what you actually did and how you resolved the problem. And that resolution is really important. So it's how did you resolve the problem, or what did you learn from the experience? So oftentimes people will specifically ask you about a time in your professional life or in your clinical life when you encountered something. So for example, tell me about a time that you made a mistake, or tell me about a time that you had a conflict with a coworker or a patient. And they might specifically ask you about a professional experience. So my suggestion to you, if you cannot think of an example, is to use a personal one and to just say, I can't think of a professional example of that, but here's a personal one. And at the very least, it will give you some time to reflect on maybe a better example in the future. But really, the only way you can prepare for this is to do that reflecting and have a couple of stories queued up that you might be able to use for a couple of different behavioral interviewing questions. One tip that I'll definitely give you is try as hard as you can not to speak poorly about other people or other employers. That's one of the sort of crucial mistakes that we see among students and candidates that are interviewing, is to sort of not taking accountability for the role that you played in the situation. So that's just one tip I would have, to try to be as diplomatic as possible about the situation and to really think about the resolution of the situation. But if you're worried about this, I would challenge you to do some mock interviewing with either a member of Jody's team or even with one another. Or with your parents or your roommate or your best friend, because sometimes you just need to speak the words and answer the questions so that you can see, you know, how it feels coming out of your mouth and how you can sort of shift it to make it an even better answer. You know, Marta and I have both done this many times before, but we even practiced this presentation just to hear the words coming out of our mouth and to make sure that we were, you know, stating what we intended to. And I think a good tip I would have for you is that, you know, practicing can only make you more qualified and perform better in the future.
Great, awesome. So we are rounding out the interview, whether it's with the hiring manager or even the group of peers or whoever. This is where, and I did touch on this previously, is saving those logistical questions for recruitment, things like salary, benefits. That is what we are here to do. We are here to help facilitate the process and answer those questions for you. The next is to end with a strong question. So coming up, and if it's not a strong question, having the questions for them. They will always ask you, do you have any questions for me? Making sure that, you know, you've gotten most of your list, if not all of your list of questions answered. I think that rounding out your interview really would just give that manager a lasting impression of you. So having those strong ended questions. And then don't be afraid to let them know, I really want this job. And again, emphasizing why you would be a really great fit for the organization. If, of course, after the interview, you feel like it's a really good fit for yourself, letting them know why, and just showing that true passion if maybe it didn't quite during the interview in itself. Again, then checking back with recruitment for updates. The managers will usually say recruitment will follow up with you with any updates. And then sending those thank you notes. Getting those thank you notes and sending it, and maybe asking the managers also for their contact information, or, you know, reaching out to recruitment to ask them to pass on a message, or however each organization does it best. So just really, you know, I think that, again, it's important to remember this is an interview. You are also performing the interview for them. So I think what I see or hear on the end of managers is that we are just as hopeful that you would choose us as much as, you know, if we would choose you. I do see that a lot of times from the managers, like, oh, I really hope they pick us. I really hope they pick us. So just something to keep in mind, that you're here also to pick the right fit for you. I'm going to look at my notes to see if we missed anything. Annie, was there anything else that maybe?
Yeah, I think just two last thoughts. One is the strong question is a great suggestion, Marta. I often think the best last question is to throw it around on the organization and ask them, what are you looking for in a candidate? What makes a candidate strong for you? Or like, what's your biggest goal with a new grad class? Or what's your biggest need from a nurse on this unit? So that you can really find out what's at the core of it for them. And again, make one final sort of pitch for why you would be a good candidate for the role. What Marta said about, I want this job, it came from this experience that I had with a nurse who ends up also being a nurse recruiter, and she was wonderful. So she knows that I tell this story, but she was not the most qualified candidate for a very competitive position in pediatrics at Georgetown. And she ended the interview by saying, I want this job, and I am going to work so hard. If you give me this job, I will be the best nurse that you have had on this unit. And she truly was. And so that really put her over the other candidates, that level of passion and commitment for the role. It's not the best strategy to use in every interview, but in this particular case, knowing how much she wanted the job really made her the candidate for them. So just a thought, if you are interviewing for something particularly competitive, to let them know how much you want it could definitely be a benefit. And then we are going to end the presentation and definitely answer questions for you. So feel free to chat them to us or to unmute yourself. I'm just going to end the slideshow. And then I'm just going to try to unshare here. Okay, great. Does anybody have any questions that we can answer for you?
It looks like we did get a question in the chat from Geraldine. Great question. Is it inappropriate to take notes and write during the interview? Absolutely not. I think that there's a fine balance between taking notes and making sure that you're still paying attention during the conversation, but that is totally appropriate to do during the interview.
Absolutely. I agree too. And if it's a virtual interview and it's not clear what you're doing, that you're looking down and writing, you might just want to let them know, I'm taking notes, so they don't think you're checking your phone. It's very self-evident when you're in person in the same room with someone, but it might not be as self-evident if you're doing a virtual interview. if you're newly pregnant when interviewing, is that something you would disclose? That's completely up to you. It is never something that we would use to judge whether or not you're a good candidate. It's absolutely not something that we use because of equal opportunity employment.
Right.
So it's also something that you could consider disclosing to the recruiter, but not the manager, or to both, or to neither. It again is really completely up to you, but just to reaffirm that we would never use that as a reason not to select you for a position. It absolutely would have no impact. The majority of, not the majority, but it's just a huge proportion of the nurses that work at our hospital are parents, and definitely very committed nurses. And it's absolutely possible to do both. Marta, should we just mention quickly about our residency and
Oh,
nurse tech opportunities as well?
yeah, you can go ahead and then I'll
Okay.
follow.
Okay, great. So Medstar Georgetown is currently hiring for our winter nurse residency, which begins in February. So if you are a December grad or you're a fall grad and you're looking for an opportunity, I'm going to share my contact information with you and also share the flyers for our nurse residency program in the chat at the end of this meeting. We are also hiring for our summer nurse externship beginning in December. And that would be a 10-week paid externship over the summer, where you would just walk right across the huge construction site and work with us. We have opportunities in every different area, also opportunities for you to work throughout the school year, and a scholarship that you'd qualify for by participating in that externship. So if there are any juniors or sophomores in the conversation, I'd be happy to talk to you more about that. So again, I'll share the flyers and my contact information, but I know many of you have clinicals over across the way at the hospital. So I really encourage you to stop by the nurse recruitment office if you are in the hospital on the first floor of the main building, and ask for any one of us. We would be happy to provide you with guidance, talk to you a bit about our application timelines and flyers, and give you lots of fun giveaways like eye masks and pens and Sharpie markers and all that kind of good accoutrement.
That's awesome. Thanks, Annie. So for Virginia Hospital Center, we are also on a very similar timeline. We do have applications open at the moment for any winter graduates. This is for the spring residency program to start sometime in February and March, in that timeline. So if you graduate in December, now is the time to apply. And then to follow, we also open applications up. If you are a May graduate, we open applications up very early as well. So sometime in the January, February months, we will start opening applications and recruiting for those positions. And I know that several of our externs here, I've talked to you before about a different kind of process with being a current employee. So if you are interested in staying on board, feel free to reach out to me. But those applications do open up earlier to the internals. So just something to remember. We also do have an summer extern program, and we usually open those applications up in late December, January, and hold interviews sometime in February. So again, this is about an 8 to 10 week, if you include some of the orientations and whatnot, 8-week program during the summer, and you are hired onto a unit that we try our best to match you with. But we also do provide you with shadow opportunities during that program if you're not on the unit that you wish to or that you're placed on. And then, as always, if you wanted to get a little bit more of a clinical experience, aside from all the clinicals that you already have, we do have many positions for clintechs. And this is a really great way to continue practicing those skills, maybe even get your foot in the door with that unit that you might be interested in working on, and just getting a feel for what it's like to maybe work on an ICU or a general medical surgical unit, and seeing, is this really a good fit for me and organization and unit wise. I hope I answered all the questions. I'm going to go ahead and put my contact information. Feel free to reach out to me. And then we also do have a website that we present a lot of our new grad information on, as well as the timeline. We update that when we are opening up a new round of applications, and always happy to discuss any details or answer any questions that you might have about the organization or the recruitment process or anything here for us. So I'll go ahead and put that in and then hand it over back to Annie.
We do have 2 more questions for both of you, just in case you missed them. One is, if we have worked as an extern or a tech on the unit we're interviewing for, should all of our answers to situational questions come from our experience on the unit, or should we bring in outside examples? Great question.
I think that the best way to answer that question is with the best examples. So if it does make sense, if the best example, the best answer that you have comes from your experience, I would use it. Otherwise, I would answer the best way that you can. The one time I'll remind you to be sort of mindful about that is if somebody asks you, why do you want this job, or why did you become a nurse? Make sure that your answer to that question relates to the unit you're interviewing for. And again, that's pretty obvious, but we often get people who tell us that they were drawn to nursing because they're very interested in becoming a pediatric nurse practitioner, but they're applying for a medical surgical unit. So you just want to make sure that your goals, as you're stating them, align with the position that you're interviewing for. But otherwise, I would use the best example.
I wanted to touch on that too, Annie, because, and I almost feel like as you all start your interviews and nursing careers, it's my way of kind of like looking out for you, so to speak, because I did just have this happen and I had a really disappointed candidate, and it kind of is what it is. So there is a trick question that they like to ask, and it's, where do you see yourself in like 3 or 5 years? And I like to share this a lot because, it catches you off guard. And I usually like to share that thinking about what you have to say to that question versus what the manager is going to hear can be very different things. So just a really quick story. So I had a candidate who interviewed, and he asked her the same question, where do you see yourself in 3 years? And she said, oh, I see myself doing like pediatric NP or something like that. And it was not pediatric related, the unit they were interviewing for. And he said no, because what he anticipated, or what heard, and not all managers are like this, but it's just how you formulate your answer to the questions, is he heard, okay, I'm gonna train her for about a year or 2 and then I'm gonna lose her. So they look for the longevity, they look for getting that true experience to really meet your goals. So it's okay to say, I don't know where I see myself in 3 years. It's okay to say that, but you don't really want to disqualify yourself for, basically telling them I'm going to leave in 3 years. So I just wanted to put that plug in.
And also, you don't know where you'll want to end up being. I mean, I think for many of us, and I'm an example of someone who thought I wanted to be a labor and delivery nurse and a midwife, and I ended up in the PACU and now in nurse recruitment. So if you ask 10 nurses where they ended up versus where they thought they would end up, I would wager that 9 of them ended up someplace unexpected. And so, as Marta said, it's really important to be honest and to represent yourself authentically, but also, I think a great answer for that is, I want to be the best possible nurse that I can be, and learn as much as I can and grow as much as I can, because that's true too, regardless of whether you plan to go back to school in a year. That all involves becoming the best nurse you possibly can, helping as many patients as you can, being as supportive of a member of the team as you can. So that might be a good way to answer that question.
Yeah.
Great advice. It's a hard question. We do have one other question. How many days do you typically give for someone to accept an offer for a job?
We usually give a week, but it's situational. If you had another interview in a week and, you aren't going to be able to provide a response for 2 weeks, sometimes what we'll say is, unfortunately, we can't hold the position for you, but feel free to let us know when you've concluded that interview, if you'd like to move forward, and if the position is still available, we can then, you know, move forward together. But generally for us, we can only hold positions for you for a week, because there are, you know, if you're interviewing, there are probably 3 or 4 other candidates who are interviewing along with you. And so when we give you a week and then 2 weeks and then 3 weeks, it means that those candidates are then waiting for their response as well. So we're just trying to be as fair as we possibly can to all the candidates.
I will have to say the same thing. We give about a week as well. And again, it's also okay to let us know, like I do have, and we totally understand that you have options. So it's okay to let us know, I have this interview on Thursday. Can I give you an answer then? Or again, just keeping in mind the timeline. I also usually tell new grads up to a week, if not sooner, if possible, just because of the other candidates. We're holding that spot for you based on whether you accept or not.
Great. Well, thank you everybody for the questions. I think that's all we have. So everybody could give a virtual, thank you to Marta and Annie for spending your time this evening with us. We greatly appreciate it. And it looks like thank you for putting in your contact information. So if there's any other questions, you have that. And just want to thank you again. We really appreciate it. And we'll look forward to seeing your job postings.
I hope to see you in the hallways and hope to receive many of your applications. And Marta, thanks so much for partnering for the presentation. It was fun.
Of course, always enjoy working with you, Annie. And also same to you all. Hope to see you all or hear from you all in the near future.